Oh, hello there, my lovely. You make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. So what can I do for you today? Okay. So you're feeling a little bit dizzy and your ears are hurting. All right. Any other symptoms? Any cough? Blocked nose? No? Okay, how long have you felt like this? Okay. All right. Okay, so you've not had any cold or allergies that you're aware of? No? Okay. Any problems with your ears in the past? So you do get wax problems, okay. And is your dizziness affecting you when you're standing, sitting, lying down? Right, okay. Is it all the time or just intermittent? All right. Do you have a feeling of fullness in your ears? Okay. And have you been doing any swimming recently? All right. Do you put Q-tips down your ears? Okay. All right. Well, that's not a wise idea. It may be that you've pushed some earwax deep down, but we'll have a look at that. Okay. Yeah. Okay. All right then, my lovely. Well, first things first, I'll do a little check of your temperature just to make sure that there isn't any infection going on there. All right. So I'm just going to pop this inside your ear. All right. There we go. Just hear a beep or two. That's fine. There's no infection there. Right, so have a little feel of your lymph nodes. I'm just going to pop some gloves on now. The temperature, it was 37, so that's absolutely normal. Nothing to worry about there. Okay, so just look straight ahead for me. I'm just going to have a little feel of the lymph nodes around your neck, under your jaw, and just at the back of your head, all right? Okay. Okay, just round the back. Okay. All right, that seems fine. Okay, I'm just going to check just inside your elbow. There's a lymph node there that's quite hard to find, but I'll just want to check it. Okay, if I can. Just relax your arm for me. Okay, there's no worries there. All right. Do you mind if I take a little look inside your throat? Okay. I know, it's not the nicest thing, is it? Okay. Right. Open nice and wide for me, my lovely. Okay, there we go. Just going to shine this light in. Okay. Say R for me. Okay. That's lovely. And while I'm at it, I'll have a little look in your eyes. Okay. Just look straight ahead for me for this. Okay, it's coming in there. Just checking with you, saying you're being dizzy, that's all. That I can't see anything unusual going on. Okay, that's fine. Right, I'm going to check your blood pressure, because in some people changes in blood pressure can cause dizziness. So I'd just like to rule that out first. I'm just going to pop my stethoscope in. Okay. So I'm just going to pop this cuff around your arm and inflate it, alright? It will go tight, but not for long. Okay? Let's get that on there. Just relax your arm for me, my lovely. Thank you. Right. Perfect. Right, just going to pop my stethoscope under there so I can hear the artery. There we go. And just going to inflate that now, okay? Just stay nice and relaxed. That's fine. No worries there at all. Okay. There we go. Let's get rid of that. Okay. Just going to pop the stethoscope onto your neck a second. Just breathe normally for me. Just a little quick listen to your chest. Deep breath in for me. And again. Again. And again. That's fine. I was just listening to see if there was any crackles or whistles or anything strange going on, but absolutely nothing. So I don't think there's any infection at the moment that I can see. Alright. So what I'm going to do next is have a look around the ear and inside your ear, okay? Right, let me just give the ears a nice wipe first. Just got a nice gentle wipe, okay. Just around the outside to remove any debris. We don't want any of that going down your ears. Just little bits of dust and things that we pick up along the way during our day. Okay. You doing all right there? Perfect. Right. Let me have a look at your right ear. Okay. I'm going to use the Otoscope. See, it has a light on it, and this speculum goes inside your ear canal and lets me have a little look around in there and see what I can visualise. I'd like to be able to visualise the eardrum and the structures behind it, but if there's a wax impaction, the chances are I won't be able to see that. Alright, so I need you to keep very still for me. Pop up your hand if you're not comfortable, but please don't move, alright? Okay. So I'll just be pulling up and back very, very gently, alright? Very gently. Here we go. And going to insert that now. Here we go. Alright. There's some wax down there for sure, and it looks quite firm, so I'm guessing that's what's causing the ear pressure and a little bit of dizziness there. It's pushing against your eardrum. Is that a little bit sore? Okay. Ear canal looks a little bit irritated too. You okay there? You're not dizzy? Good. Try and keep that head still for me. We're doing really well. I don't want to make you dizzy, I want to make you feel better. Okay, so I'm just going to pull up and back again, my lovely, and insert this again now. Okay. Right, let's take a look here. Definitely some hardened wax on this side as well. Looks very impacted. Okay, the ear canal looks a little red. Is that a little bit tender too? Yeah, okay. Okay, I'll remove that now. Okay. You alright there? Good. I'll just update this a little. Okay. So what I'm seeing in both ears is an impaction of wax. Okay, this side looks like it's a little bit more blocked. Are you getting more pain on this side? Okay. So there are various ways we can remove earwax, and I know you've probably had some things done before if you've suffered with earwax problems, yeah? So my first line of attack is to use some really nice fizzy drops, okay? My patients usually love these, so I'll just put a few down each ear, and then you'll hear a fizzy crackly sort of sound, alright? And that will be the sound of the drops breaking down that hard wax, so it makes it easier for me to remove it, okay? You can buy similar things from the pharmacy, but these are stronger, okay? But they won't sting or burn, right? So, just give them a little mix up. I'll pop some in your right ear first, okay? Right, here we go. They'll feel quite cool going in. So here's one, two, three, four. I'm going to put four in that side because it looked a little bit worse than the other one. Okay, give that a little rub. And then to pop a few in this side. Here we go. Here's one, two, and three. And a little massage here. Okay, so you'll be fizzing nicely now. Let's just get a few things ready. Okay. So I'm going to use this long-handled spoon-shaped tool here just to gently go in and scrape away at the wax, okay? Again, keep very still for me, my lovely. I know you're very good at that. And just pop up the hand, okay, if anything hurts. All right, thank you. So let me just get some tissue there. Right, here we go. Nice and still for me, thank you. That's coming away nicely. Excellent. Oh, there's a lot come out of there just, yeah. huge hard lump, so I think that's cleared the worst of it. So we'll have a little look on this side now, see what we can get out. Nice and still. You're doing all right there, you're not dizzy or anything. Good, good. So now what I'm going to do is use my special little brush, and that will help to remove any loose particles that are down the ear, okay? Yeah? Perfect. Again, just pop up the hand if you're not comfortable, alright? Here we go, my lovely. Might sound a little bit loud, but it shouldn't hurt. You enjoyed that? Good. Okay, going in on your left side now, lovely. Wonderful. You're feeling good? Perfect. So now I'm just going to give your ears a little puff of air with this, okay? Just to remove anything from the outside. Okay. Gentle little puffs. tickled? Good. Okay. Going to have another look with my otoscope now. Just to make sure that it's all clear. You feeling better? The pressure's gone. Perfect. Just going to pull up and back and pop this in now. Okay. I can see your eardrum now. That's looking actually very healthy, which is good. Slight bit of redness in the ear canals, but that would be expected. Okay, good. Take a look at your left ear, and then you'll be pleased to know that we're all done. That's looking so much better. Yeah. Eardrum looking fine, intact, no wrinkles, bulging. Can see all the structures behind, slightly reddened ear canal again, but that's okay for now. Okay, perfect. Okay, so I'm going to pop some more drops down your ears now before you go. This will just help soothe them, okay, because I have been doing some very deep cleaning there, alright? Okay. These feel very cool and lovely. If you have any problems, just give us a call. You start feeling feverish or more dizzy or unwell, or there's any strange discharge from your ears, please just call us, but I think you'll be fine, okay? Alright. Just pop that in there. There's one. And two. Just give that a little while. Very good. Yes, they do feel nice. Okay, here's one. And two. Okay, my lovely. Well, you're free to go. Alright? I'll update your notes after you've left, and I hope you have a pleasant day. Yeah, you should feel much better by the end of the day. Yeah, your ears might feel a little bit irritated for a day or so, but those drops will help. Yeah, alright. Okay. Take care now. Bye-bye. Oh, hello there, my lovely. Make yourself nice and comfortable. Okay, so you're here for an ear cleaning today. Yeah? You've been having some problems for a little while, haven't you? Yeah, I think it's time we took a look and got them cleaned out for you. Okay, so do you have any specific pain today around the ears? Okay. All right then. Any discharge that you noticed? No, just feel really uncomfortable. Yeah. Yeah, okay. Well, you've been recommended to come to me for the cleaning, so that's what I'm going to do. Firstly, I will take a look down the ears just so I know what I'm doing, okay, what I'm working with. All right. Have you got a allergy to latex at all? No. Okay. I'll pop some gloves on. Are you feeling otherwise well? Good. Okay. Well, there are a few different ways that we can clean ears, and depending on what I see will determine which method I'll use today. Okay? None of them will be painful. Some things can feel a little bit uncomfortable if the ears are sore, but I'm very, very gentle, and you can always tell me if it's uncomfortable. Okay? All right then. So, what I'll do first is just have a little wipe around the outer ear. Okay. So just keep nice and still for me. This will feel nice and cool and refreshing. All right? Okay. Gentle wipe. There we go. There. Yes, very refreshing. Yeah. Okay. Little wipe here now. There we go. All done. Okay, so I'm going to use this otoscope here, okay, and it has a light, and I will look down your ear canal very, very gently, just so I can see what I'm dealing with down there and how bad the wax impaction is. Okay? Alright, I do need you to keep nice and still for this one. If anything is uncomfortable, please just pop up your hand. Don't move your head suddenly. Alright? Okay. Let's have a look here then. Okay. So I'll pull the ear up and back, my lovely, and I will just gently insert the otoscope in. Lovely. Okay. So there's a solid impaction there, I can see it. Just going to reposition and take another look from a slightly different angle. Okay. Your ear canals do look a little bit inflamed, but not as bad as I would have expected. okay there? You're doing really well. So just going to pull up and back and insert this now. Okay. Lots of old hard wax down here. Looking a little red also. Okay. Just withdrawing that now. Okay. Alright. So I can see that you do have a lot of hard wax down each ear canal. Yeah, but don't worry, I'll be able to remove that for you. Okay, so what I do with a lot of my patients who have this problem, I use these special drops. This is the first line of attack, okay, so I can break down the wax. This softens the wax very, very quickly. Has a little bit of a fizzy, crackly sound, okay, that's normal. It's very pleasant for most people. So I'll get some of these down your ears, and then I'll see what I can do afterwards. Right, okay, I'll pop a couple in your left ear first. Okay, here's one and two. You right there? Good. If you can hear that little fizzing sound, perfect. And again on this side. Right. Make sure they're well mixed. And here's one and two. Okay. Good. Okay. Just make a note of that. Okay. So I've got a couple of methods I can use here. I can just go straight in with a tool like this and just have a little scrape around, or I can try and use an older method, which is irrigation or ear syringing. Okay. Or you've had that done before? Right. Okay. Did you like it? Okay. We can certainly try the ear syringing first, and then I can remove anything that's left with the other tools. Yeah? Okay. Right, well, let's try that then. Okay. I have got a pre-filled syringe here, so I can use this in each ear. Okay. It'll feel a little bit warm. It's not hot, it's not cold, but it will just go down the ear, swirl a little bit, and then it'll all come out into the tray. Okay, so I've got this tray here. Yeah. Okay. So what I'm going to do is put a cover around your ears underneath so we don't get anything on your clothes, alright? Sometimes things can just splash a little bit. I'll just pop that on there, my lovely. Okay. Let's pop this one around the side. There we go. Okay. Alright, so should we start on this side first? Yeah? Okay. Right. So you just keep nice and still for me, alright? And if anything's uncomfortable, as I said before, just pop up your hand, okay? Okay. Here we go. Right then, I'm just going to get that ready. Perfect. And here we go. You're doing really well. Okay. Is that alright for you? Felt a bit strange. Yeah. It does. I'll just give them a little wipe. Okay. There we go. Okay, good. Let's take a little look at this side now. Okay then, that's in position, so you just relax and I'll start to get the water in your ear. Okay, my lovely, here we go. Well done. I think we've got most of it there by the look of it. Let's pop that there. Okay. Just going to give your ear a little wipe. feeling okay? You're not dizzy or anything? Okay, right. I'm going to take a little quick look with the otoscope again, alright? Just to see what we're left with. Okay, there we go. Popping that in now. Okay. So the hard, big chunks look like they are mostly removed. We've just got a little bit of residual wax that I can get rid of with the other tools. But they're looking much, much cleaner now. Well, this one is anyway. Let's see what the other side looks like. Okay. We're doing well. Okay, around here, just going to pop the otoscope in, my lovely. Alright. Okay. Yeah, same again here. Just a little bit extra to it. Okay, just withdraw that. Okay. So I'm going to use this little spoon-shaped tool just to remove the little bit extra there, and then I'm just going to use this special little brush just to remove any little loose bits. Okay, anything uncomfortable again, please just let me know by popping up your hand. Alright, okay. Right then, so let's start over here, I think. Please let me know if anything doesn't feel good. Okay, I'll be very gentle. There we go. just use that little brush again, my lovely. You're doing really, really well. Okay, you feeling comfortable? Good, good. I'm going to put some drops down your ears very shortly just to soothe them a little bit, okay? But I just want to check that your hearing's alright after I've been poking down there. We've got lots and lots of wax out, alright? I don't really want to be poking around there too much because it will get a little bit sore. Okay, so could you just close your eyes for me a second and tell me which ear you feel the sound of my gloves, okay? Alright, here we go. Okay, and now well done, and now okay, and now and now. Okay, perfect. You can open your eyes now. Just going to whisper a few little words into your ear. Could you just repeat them for me, please? Okay. Chocolate, keyboard, 62, car, blanket. Very well done, and I'll do the same for your right ear. Ice cream, 22, motorbike, kettle, beach. Very well done. You just relax a second. I'll just update those notes there. Okay. Right. Find my other drops. Okay. Now, these will feel very soothing. Just going to give them a little mix and a shake, just to make them feel a little bit more comfortable after I've been working down there. Okay. Okay. So I'm going to put 3 of these down each ear. All right. Okay. ears. 1, 2, and 3. Okay. Nice. Good. And 1, 2, and 3. There we go. So I'll just give the ear a little massage. Okay, perfect. And I'll remove that cover. You like the massage? Good. Just helps to get the drops down. Just a little massage here. There we go. And I'll just remove that cover. Okay, my lovely. Well, if you're feeling fine, you're free to go. If you want me to check on you next week, I can, but if everything's fine, you don't have to come back. But if anything feels uncomfortable, just please give us a call, okay? Or if you feel that they're starting to block up again, yeah? You could use some olive oil drops down your ears. That really helps keep the wax compaction away. You're not going to stop producing the wax, but it helps keep it soft. Yeah, and please don't stick anything down your ears, but wax will naturally move to the outer ear, so you can remove it there. Yeah. Okay? Alright. Well, I hope you're much more comfortable now. Alright. Okay. So you take care and have a good day. Bye-bye.